In 2013, Hollywood star Angelina Jolie revealed that she had both her breasts removed because she had the BRCA1 gene mutation. This gene mutation significantly increases the risk of developing breast cancer. Her mother died of cancer and she had an 87% risk of developing breast cancer. While this preventive measure is difficult but life-saving for those at high risk, more than 90% of people who develop breast cancer do not have a family history at all. Yet, it is the most common cancer among women worldwide. What other factors could be responsible? Hello and welcome, you're watching Happiest Health, and in this episode of the Y-Axis, we talk all about breast cancer. I don't have a family history, so I won't get it. I lead a healthy lifestyle, so I won't get it. Older women are at risk. I don't have to be worried now. If you're a woman who has said any of these, then this video is for you. Most of us know breast cancer as something that starts off as a lump or an unusual growth. Now that lump must be painful, right? No. In most cases, breast cancer is silent and painless to start with.
If you see 100 breast cancer patients, hardly maybe 2 or 3 would actually complain of pain. So pain is not a very common complaint in the breast. Everyone thinks that you should have pain, you should have different kind of symptoms like maybe loss of weight, loss of appetite, you should feel tired, lethargic to have breast cancer. And I would say no, breast cancer is very, very silent.
And when pain comes, it is often a sign of advanced cancer. So even in the presence of a lump, it is a painless lump to begin with. Unless and until they keep a check on how their breast texture is, it will be difficult for them to find out any abnormality one day.
While breast pain is very common among women, it is a cause of worry if it prolongs beyond the time around one's menstrual cycle. Experts recommend a self-examination every month for every woman, including teens.
If you consider the day your period started as day 1, between day 7 and day 10 is the ideal time to do a self-breast examination. Stand in front of the mirror, look at yourself, look at the breast. Do they look symmetrical? Do they look the same? Is one breast different in shape or size? Does the skin look normal on both sides? Is the nipple retracted, pulled inwards? Then lie down and using the flat surface of your fingers, and if this is the breast, start from the nipple and gently press down on the breast to feel the breast. Many a times you may not be able to feel the lump. The lump can be deep down in the breast and maybe not felt at all. So the only changes you may notice is that one breast is becoming bigger than the opposite, or one breast is becoming smaller than the opposite. You could also notice that the skin on the breast is changing. It's becoming thicker. The skin appears like the skin of an orange. All they might feel is a lump in their underarm. So with time, you learn to identify what your breasts feel like, and if you feel any kind of a lump, a thickening, that should be evaluated immediately, and ideally done every month.
Sometimes there's a spontaneous nipple discharge. Sometimes there is a spontaneous blood-stained nipple discharge. So that is also a sign of malignancy often. And these are all the findings that the woman can see on inspection. Clinical breast examination is done by a healthcare professional, which we generally say that you can do it once in 2 to 3 years, but after 40 years of age, you should do it annually.
In India, 1 in 29 women develop breast cancer during their lifetime. It is not necessary to be old or have a family history to develop breast cancer.
A huge percent, I would say about 48% of breast cancers occur in women less than 50 years of age. Most cancers, including breast, 90 to 95% of breast cancer patients do not have a family history.
Do men get breast cancer too?
So breast cancer in men is very rare. We would say about less than 1%. But yes, for men who notice a lump or a thickening in the breast, please do get it evaluated. There is a possibility of cancer, but more often it would be something called as gynecomastia, which is male enlargement of the breast, but that is typically more common in both sides, and breast cancer is rare on both sides. It would probably be on one side, an isolated lump in some part of the breast.
Wearing a bra does not cause cancer according to studies conducted so far. But there are other risk factors that one must consider.
We say somebody whose periods start very young, menarche at a very young age, like 8, 9, 10, or menopause is delayed beyond 55, someone who's not had children, or somebody who gets pregnant at a much later age, above 35 years of age, someone who's obese, someone who drinks, someone who smokes, lack of physical activity, all increase the risk for breast cancer.
From puberty and pregnancy to genetics, there are several reasons why breasts differ in shape, size, position, form, and volume. Now, that is normal. Regular examination is what will help you identify what is not normal.
Something persistent for the last 1 or 2 months, they must visit the doctor and get it clarified. Most of the times the lumps are benign, especially in younger individuals. But as they grow old, they should not anyway neglect any lump. It could be benign, good news for everyone.
In short, the strongest breast cancer risk factor is the female gender. So the next time you look in the mirror, remember to look thoroughly.